If you wake up every morning with a dry mouth, even using a CPAP, even thinking you're breathing normally while you sleep, your body may be trying to warn you about something happening all night long that most people completely ignore. I need you to stay with me for the next few minutes, because what I'm about to share with you isn't just a minor inconvenience. It's not something to brush off as, I just need to drink more water before bed. What you're experiencing, that dryness, that sticky, parched feeling the moment you open your eyes, can be your body's way of raising a quiet alarm that, if ignored long enough, can lead to consequences far more serious than anything you'd expect from something as simple as a dry mouth. My name is Sarah, and I'm a physician. Before I go any further, I want to be transparent with you. If I'm not certain about something, I won't say it. I don't invent statistics. I don't manufacture studies to make a point. Everything I share with you today comes from established medical understanding, real clinical practice, and what I see again and again in patients who come to me frustrated, confused, and concerned. What I'm about to explain is real, it's documented, and it matters, especially if you're over 65. So let me ask you something. When was the last time you woke up and your mouth felt completely normal? Moist, comfortable, ready to speak without that thick, cottony feeling coating your tongue and the roof of your mouth? For many people, and I mean millions of people over 65, that feeling has become so routine that they've stopped questioning it. They've accepted it as just another part of getting older. They drink a glass of water, move on with their morning, and don't give it another thought. But that acceptance, that normalization of a symptom your body is actively producing for a reason, is exactly the kind of quiet mistake that compounds over time. Let me explain what's actually happening. The most common and most underestimated cause of waking up with a dry mouth, especially in older adults, is a breathing problem that occurs while you sleep. And I'm not just talking about loud, obvious snoring. I'm talking about a pattern of airway obstruction, partial or complete, that can happen dozens of times per night without you ever being fully aware of it. This is what we call obstructive sleep apnea. And it is far, far more prevalent in adults over 65 than most people realize. When your airway partially closes during sleep, which can happen due to the natural relaxation of throat muscles, changes in tissue tone as we age, weight distribution around the neck and jaw, or even the position you sleep in, your body compensates by shifting from nasal breathing to mouth breathing. The moment that shift happens, your mouth becomes an open ventilation channel for hours at a time, with air flowing in and out continuously, evaporating the moisture from your oral tissues. By the time you wake up, the damage is done. You feel it immediately, that dryness, that discomfort. And you might even have a headache, a sore throat, or feel like you barely slept at all. And here's what so many people don't understand. Breathing through your mouth while you sleep is not a harmless habit. It's a symptom. It's a signal. And in the context of sleep apnea, it is associated with significant cardiovascular risk. People with untreated obstructive sleep apnea have a dramatically higher risk of stroke and heart failure compared to those who sleep with normal, unobstructed nasal breathing. This is not a fringe idea. It's reflected in decades of cardiovascular and sleep medicine research. When your body is deprived of adequate oxygen repeatedly throughout the night, your heart works harder, your blood pressure spikes repeatedly during those apnea episodes, your nervous system stays in a low-grade state of alert, and the cumulative effect on your cardiovascular system is real and measurable. I see patients who have been told they snore a little bit. I see patients who use a CPAP and still wake up with a dry mouth, which often means the mask isn't sealing properly, or that mouth breathing is occurring around the device. I see patients who have never been diagnosed with anything, who have never been evaluated for sleep apnea, but whose symptoms are practically screaming the diagnosis at them every single morning. And that's why I need to pause here and speak directly to you. If you've been waking up with a dry mouth consistently, not occasionally, not after one too many glasses of wine, but every single morning. Please take this seriously. Talk to your doctor. Ask specifically about a sleep study. This is not something that can wait indefinitely, and it is not something that resolves on its own with age. Before I go further, if what I'm sharing today is helping you understand something about your own body, I want you to do something right now. Subscribe to this channel, leave a like, and drop a comment below. Tell me your age and where you're watching from. I read those comments, and they help me understand who needs this information most. You'd be surprised how many people are sitting in the exact same situation you are and thinking they're completely alone in it. You're not. Now, dry mouth during sleep and upon waking isn't always about sleep apnea alone. There are several other causes that are important to understand, and they often overlap in ways that make the problem worse. One of the most overlooked is what I call late afternoon dehydration. Many older adults progressively reduce their fluid intake as the day goes on, sometimes out of habit, sometimes because they're worried about nighttime trips to the bathroom, sometimes simply because thirst sensation naturally diminishes with age. What people don't realize is that if you begin the night already mildly dehydrated, drinking a glass of water right before bed doesn't fully resolve it. Your body needs time, hours, to absorb and distribute fluid. So that late-day fluid deficit follows you into sleep, and by the time morning comes, your oral tissues have had hours to dry out without adequate hydration to support them. Then there are the nutritional factors, the cells that line your salivary glands, the glands responsible for producing the moisture that keeps your mouth comfortable, depend on certain vitamins to function properly. Vitamin A plays a critical role in maintaining the mucous membranes throughout the body, including inside the mouth. B vitamins, particularly B3 and B12, are essential to cellular energy production and nervous system function, including the nerve signals that trigger saliva production. Deficiencies in these nutrients, which are genuinely common in adults over 65 due to changes in absorption, dietary patterns, and medication interactions, can quietly impair salivary gland function without any dramatic symptoms beyond that persistent morning dryness. There's another connection I want you to consider carefully, because it's one that catches a lot of people off guard. If you're waking up with a dry mouth and also noticing that you're getting up multiple times during the night to urinate, those two symptoms together can be an early signal of blood sugar dysregulation, and in some cases, undiagnosed type 2 diabetes. When blood sugar is elevated, the kidneys work overtime to filter and excrete that excess glucose, which leads to increased urination and, in turn, systemic fluid depletion. The mouth is one of the first places that depletion becomes noticeable. This is one of the reasons I always ask patients who report morning dry mouth whether they're also experiencing nighttime urination, unusual thirst during the day, or changes in their vision or energy. These symptoms in combination deserve a fasting blood glucose test, not a wait-and-see approach. For women over 60, and I want to speak directly to you for a moment, there is a condition called Sjögren syndrome that is chronically underdiagnosed and deserves far more attention than it receives. Sjögren's is an autoimmune condition in which the immune system mistakenly attacks the body's moisture-producing glands, including the salivary glands and tear glands. The result is persistent dry mouth, dry eyes, and sometimes joint pain or fatigue. Because these symptoms develop gradually and can be attributed to aging or menopause, many women go years without a correct diagnosis. If your dry mouth is accompanied by consistently dry eyes, difficulty swallowing dry foods, or unusual joint discomfort, please mention Sjögren specifically to your doctor and ask whether testing is appropriate. And speaking of things that deserve more attention, I want to mention something briefly. In the first link in the description below, there is a method specifically designed for people who want to address the root of their sleep and breathing quality at a deeper level. Not just a bandage solution. A structured approach to the core problem that's behind that dry mouth, that restless night, that foggy morning. If you've been waking up exhausted, barely feeling like you slept at all, and you've tried everything without lasting results, please take a look. The longer you wait on something like this, the more time passes where your body is going through those nighttime cycles without the support it needs. And when it comes to cardiovascular risk, sleep oxygen levels, and cognitive health in your 60s and beyond, time is genuinely something you cannot afford to keep spending without addressing this. Now, let me talk about something that affects the majority of adults over 65 who take prescription medications, and yet is almost never discussed in a doctor's office in the context of dry mouth. There are more than 500 commonly prescribed medications: antidepressants, antihistamines, blood pressure medications, diuretics, bladder medications, and many others that have what's called an anticholinergic effect on the body. In simple terms, these medications can block the nerve signals that tell your salivary glands to produce saliva. If you're taking one of these medications, or more than one, which is common in older adults, you may have a compounding anticholinergic burden that's silently reducing your saliva production every single night. This isn't a small inconvenience. Chronic dry mouth from reduced saliva creates a dramatically higher risk of dental cavities, gum disease, and oral infections. Because saliva is the mouth's primary defense system. It neutralizes acid, washes away bacteria, and remineralizes tooth enamel. Beyond oral health, higher anticholinergic burden in older adults has been linked in research to increased risk of cognitive decline. If you haven't reviewed your medications with your doctor specifically in the context of these effects, that conversation is worth having. Now, let me give you something practical, something you can observe and apply starting tonight. The single most impactful behavioral shift for nighttime dry mouth related to mouth breathing is creating a deliberate nasal breathing habit before you fall asleep. This sounds almost too simple, but it's grounded in real physiology. Nasal passages filter, humidify, and warm air before it reaches your lungs. When you breathe through your nose during sleep, moisture is conserved, airway resistance is moderated, and the cascade of oral drying that comes from mouth breathing simply doesn't happen to the same degree. Spending a few minutes before sleep focused on slow, deliberate nasal breathing, and sleeping on your side rather than your back, which helps keep the airway more open, can meaningfully reduce the severity of mouth breathing during the night. For hydration, begin shifting your water intake earlier in the day. Aim for consistent, steady hydration from morning through mid-afternoon, and allow yourself a modest amount of fluid in the early evening. This gives your kidneys time to process the fluid before sleep, reduces nighttime bathroom trips, and ensures you enter sleep already adequately hydrated rather than playing catch-up. Avoid alcohol in the evening. It is a profound desiccant and airway relaxant, meaning it both dehydrates your tissues and makes airway obstruction more likely during sleep. If nasal congestion is contributing to your nighttime mouth breathing, addressing it proactively can make a real difference. A saline nasal rinse used before bed can clear mucus and reduce inflammation in the nasal passages, making nasal breathing more accessible throughout the night. Elevating the head of your bed by even a few inches, using a wedge pillow or adjustable base, can also help reduce post-nasal drip, ease sinus pressure, and reduce the tendency for the tongue and soft tissues of the throat to fall back and obstruct the airway. For nutritional support, if you're not already taking a high-quality B-complex vitamin and ensuring adequate vitamin A through your diet or supplementation, these are worth discussing with your physician, particularly if you're on any medications that might be depleting your B12 levels. And before I move forward, I want to come back to something important. If you are waking up with a dry mouth every single morning, feeling unrefreshed, dragging yourself through the day with fatigue that no amount of sleep seems to fix, there is a reason for that. And there is a structured approach available to you that goes beyond lifestyle tips. In the first link in this description, you'll find a natural method specifically designed to address the sleep and breathing patterns at the core of this problem. I want you to go look at it, not tomorrow, today. Because every night that passes without addressing this is another night. Your cardiovascular system, your brain, your kidneys, and your immune system are operating under that low-grade, nighttime stress. The risk doesn't pause while you wait to feel ready. Please don't let hesitation cost you something you can't get back. Before we get to the end, make sure you're subscribed to this channel. New videos go up regularly, and every one of them is designed to give you real, usable information about your health. Not fear, not confusion, just clarity. There's one more layer to this that I want you to understand because I think it's the piece that most doctors simply don't have time to explain. The connection between sleep quality and virtually every system in your body is not metaphorical. It is mechanistic and direct. When you sleep, your brain activates something called the glymphatic system, a kind of fluid-based waste clearance process that flushes cellular debris, metabolic byproducts, and inflammatory proteins from brain tissue. This process is most active during deep sleep, particularly during the slow-wave stages. When breathing is disrupted during sleep, when apnea episodes are pulling you out of those deep stages repeatedly, the glymphatic system doesn't complete its work. The waste accumulates. And there is growing scientific interest in the relationship between chronic poor sleep, impaired glymphatic clearance, and the accumulation of proteins associated with Alzheimer's disease. I'm not telling you that your dry mouth will give you Alzheimer's. That would be irresponsible. But I am telling you that the same sleep disruption producing your dry mouth may also be compromising one of the most important nightly maintenance functions your brain performs. If that doesn't make this worth taking seriously, I don't know what will. I've said a lot today, and I want to bring it back to something simple. Your body is not dramatic. It doesn't produce symptoms without cause. When you wake up with a dry mouth, your body is not being theatrical. It is responding to something that is actually happening night after night in ways you may not be fully aware of. Whether that's an airway that's partially collapsing and forcing mouth breathing, or a medication that's silently blocking your salivary gland function, or blood sugar instability creeping up without a diagnosis, or a hydration pattern that's been slowly working against you for years. The symptom has a cause, the cause has a solution, and you deserve to understand both. Don't be the person who spends years dismissing a signal that was trying to protect them. The information exists, the conversations with your doctor can happen, the lifestyle adjustments are real and doable, and the deeper, more structured support, for those who need it, is available. Please, if you haven't already, subscribe to this channel. Leave a like on this video. Share it with someone in your life who wakes up feeling like they barely slept, who drinks water before bed and still wakes up parched, who has been told they snore and hasn't done anything about it yet. You might be giving them the push they needed to take this seriously. And that is not a small thing. Take care of your sleep. Take care of your breathing. Take care of your body tonight, because it's working harder for you than you know.